Well, it's important that we measure obesity rates and physical activity rates because we know that they're linked to health. Particularly obesity, we know it's linked to diabetes and linked to heart disease, and then thus it gets linked to healthcare costs because people who have obesity, diabetes have more health problems. But when I think about obesity, I think more in terms of communities. I don't think about the individuals who are overweight or obese. I think about communities and what's going on in those communities that's leading to the obesity. Because I know most people want to be healthy. They want to be physically active. They want to eat right. But sometimes the stresses in the communities or the ability in communities to actually make those healthy choices are not there. And so the study that came out also looks at the fact that if you have unstable housing, if you don't have good transportation, if you're food insecure, all of those factors also are linked to obesity. So we really need to think about what's going on in our communities. Are communities healthy enough to really support healthy behaviors?
So you're talking a little bit about that social context. What do you think can be done about it?
Well, that's what the benefit of the SHIP program is, the Statewide Health Improvement Partnership, which really has been focusing on changing the communities in which people live and work and go to school. They change the policies and the systems and the physical and social environment by working collectively with people, leaders in the community to change those policies. And so SHIP is a good example of how we can address obesity and physical activity and tobacco use. A lot of the things that really impact health, particularly obesity, are not just about access to food and not just about physical activity. They're really about what's the economic situation in our community. Most people who are physically active and eat well and have normal weight think this is somebody else's problems. And I'm thinking about the public officials and communities throughout the state, the city council members, the county commissioners, the business community. They say this is somebody else's problem. Actually, it's everybody's problem. It's the conditions in those communities that are impacted by the policies that are put forth by the business community and the policymakers at the city and county level, and all of the business leaders in those communities. It's the policies that they put that really shape those communities, and that's what's going to impact this. So people throughout the state really need to pay attention to obesity as an indicator of the well-being of their community.
And so let me ask you this. These numbers relate directly to adults. Do you think it's possible to change the behaviors of adults so that we can turn these numbers around?
We know that adults can change their behaviors if given the right situations. We know that when people are given safe, stable, and secure housing, when they have not had that before, their behaviors change. We know that if we put people into a community that's safe, has good amenities, that it's really a nice place to walk and bike, people actually do that. We know that if you build bike paths, people will start to bike. We know that if you put walking paths around, people will start to walk. People want to do the right thing. We just make it so hard sometimes for them to do the right thing. So I firmly believe that people can change their patterns if we change the community in which they live.